Can I go ahead? Be seated. Okay. Well, good afternoon. I'm going to call the Council-in-Committee meeting to order. I'm Councillor Judy Villeneuve, the Acting Mayor right now, so I'll be chairing the meeting. And we have one delegation with Nancy Bryan, who's the Territory Manager, and Dave Patterson, Director of Donor Relations with the Canadian Blood Services. So welcome to Council.
Thank you very much.
I'll just let you move forward with your presentation.
Great, thank you. First of all, thank you very much for your time tonight. By a small token, we've greased you all with cookies. That's really all we give back when people come to give blood. We give you juice and cookies, and it is the most beneficial for many of our donors. And it's actually, if you ask many of our donors why they come, at the end of the day, it's for the treats and to speak with the glowing volunteers. So tonight we're here to talk to you a little bit about Blood Week, but really more about Canadian Blood Services, what we do, where we sit with respect to our business situation and relationship with Surrey, and where we'd really like to grow it. We see a significant opportunity in the city of Surrey, significant population base, considerable diversity, which benefits us in a number of ways, and I'll speak to them in a little bit. But first, a little bit about who we are. So most people know Canadian Blood Services as the blood guys. We're the people that you hear, come donate blood, and truly that is the biggest piece of our business. We supply blood for every patient in Canada outside of the province of Quebec. The province of Quebec has their own agency called Hema Quebec. We have a donor base nationally of about 388,000 people that on average give just a little over 2 times a year and deliver about 800,000 units of blood. And when we talk about units of blood, we're talking about blood that goes directly to transplant into patients. So people who have car accidents, who are awaiting surgeries. We're not talking about different types of blood products that are used to make products like IVIG and things that go to treat people with blood diseases and cancer treatments. That really comes from plasma. We provide a bit of it, but it's not our core business. So really our core business is about supporting patients in Canadian hospitals. We also operate the One Match Stem Cell and Bone Marrow Network. And that's really around stem cells and often the last hope for many patients who are at the end of a chemotherapy, cancer treatments, and a variety of blood diseases. So stem cells have been gaining a lot of awareness over the last number of years. And I'll talk a little bit how, in particular, this product line and this work that we do in this area is really helped by the diversity that Surrey represents. The third core part of our business is a national public cord blood bank. As many of you know, if your daughter or niece, etc., is having a baby at many hospitals, they can they can bank their cord blood. Again, a very rich source of stem cells. What we run is a national public cord blood bank, really based out of Women's Hospital here in Vancouver. We have 4 hospitals across the country. And it gives moms who are not choosing to bank for their own children and families, their cord blood, an opportunity to donate to help another patient. So it gives moms a very special opportunity not only to give life, but actually save a life as well, with a very rich source of stem cells. Some of the other work that we do that's not as well known is that we bind the national organ and tissue registries together. So those are run provincially. For example, BC Transplant does it here in BC. But we connect the provincial agencies together. So we are the supercomputer in the back room that matches a donor from Halifax with a patient from Surrey. We also do a lot of work on a highly sensitized patient registries and also work on a living donor paired exchange kidney program. We do some bulk purchasing of some medical products for hospitals, and we also do a lot of research. In fact, we have a research facility here in Vancouver. It's up at UBC. It's called NetCAD, so a very large research program. Our focus in Surrey. We have a permanent clinic in Surrey. We've had it for a number of years, since 2008. We're located up across from Guildford Mall. We're open about 4 days a week, but we're only open 6 hours a day, and I'm going to come back to that 6 hours a day as well. We operate mobile clinics in Cloverdale, in South Surrey, and across in North Delta at Richardson Elementary. Overall, we collect about 12,000 units of blood a year, so not an insignificant contribution, but one that we'd certainly like to grow. On the stem cell side, as I said, we run We contribute to the National Stem Cell Registry, but also the World Marrow Donorization Registry. So if we do a stem cell match or a sample of a Surrey resident, for example, it's uploaded to our national registry to support a Canadian patient. But it's also uploaded to an international registry. So a donation here in Surrey could support a patient halfway around the world. And that's a really important part because stem cells are based on your genetic DNA. So if there's a South Asian patient, we need a South Asian stem cell, likely from that same part of the country, but definitely connected by DNA. So it is much different than the world of blood, where really, for the most part, we're looking at blood types. The stem cell program is much more specific. And one of the reasons I raise it here today is because of the ethnic diversity of Surrey. Surrey provides a great opportunity for us to expand that diversity. Currently in our one-match registry, 70% of our registrants are Caucasian. And that does not reflect the ethnic mix that is Vancouver and most large cities in Canada. So our goal is really to diversify that so that the makeup that you see in our registry reflects Canada. It's also becoming growingly complex as we get into not only broader diversity, but mixed ethnicity children, where that adds just another layer of difficulty. So now we are looking possibly for a South Asian male who marries, let's say, a Chinese lady. So now that child's DNA is even made more complex. So if that child needs a stem cell match, the broader diversity that we have in our registry, the more likely we are to be able to help that child. Our target market for that is young males 17 to 35 because they stay on our registry a lot longer, and young males because when we collect their DNA and we collect those stem cells, there's a much less reduced chance of graft versus host disease. So the doctors tell us those are the target people we should be looking after. On the organ and tissue registry, we again do some extra work here provincially. We're doing a pilot program currently with the BC Transplant, where we've actually invited them into our blood donor clinics to continue to ask people in Surrey and across the province to register their intent to donate their organs. And last but not least on this, volunteerism. Volunteerism is really the backbone of our program at Canadian Blood Services. Not only are the 56,000 blood donors we have in BC purely voluntary, again, you got the same treat today that they get when they donate blood, but they also help us in a number of areas. They man our clinics, so those folks that you see at refreshment, for those of you who are donors, are all volunteers. They're people from the community who come because they believe in what we do and they believe in the work and the gifts that our donors give us. We also have an in-community cell of volunteer, and those are folks that you would see at community events. And we're going to talk a little bit about that later as well. So that's places where we seek an opportunity to help people understand the need for blood. I think the biggest myth out there is that there's just a lot of blood, and it's just not the case. While science has done a great job of helping us make human blood very safe, a quality product, we can't manufacture it in a lab yet, and until then we need donors, and that is our biggest opportunity in Surrey. So look at some of the usage. We really only profiled Surrey Memorial. It's the kind of the central hospital here in Surrey. Continued growth, of course. But not only has there been growth in the hospital and the patients it processes, but in the need for blood. So if you look at the past 6 years, we've seen a 31% increase in the usage at Surrey Memorial Hospital. And so we haven't included other hospitals in this area, but it is very similar. In fact, Surrey Memorial uses about 20% of the blood usage in the entire Fraser Valley and within Fraser Health. So it's a significant supporter of healthcare in the province, in Surrey, and for British Columbians. So a little look at our blood collections in our clinic in Surrey, and one of the reasons we're here today is because as Surrey has grown, what we haven't been able to do is grow our collections in Surrey. And as you can see, they've gone from about 10,000 and they're down around 9,000 now. So one of our goals, one of our aspirations for the coming year is to learn to do a better job really of helping the residents of Surrey understand that not only do we need them, but we need them to come and donate blood. 1 in 2 people is able to give blood in Canada, but only 1 in 60 actually does. So for us there's a huge opportunity, and it's really all about education. And it's education that we deliver through to organizations such as the City of Surrey. We have a Partners for Life program here. So it's education we deliver through champions at workplaces. It's education we deliver through the school system, through a Young Blood for Life program, a program that we run through Surrey schools. And so here's a look at some of the larger partners that we have in Surrey. There's 4 ways that we run our Partners for Life program. The one is an annual pledge program where an organization says, you know, we'll commit to donate 100 units this year, and they work towards that pledge, and we do the math and we help them keep track. We have an advocacy program, which is really the program that I'd like to talk a little bit here today, where we have organizations who say we may have a smaller employee base, but we have lots of opportunities that we can help you spread that message. We want to be able to help you move that needle from 1 in 60 to 1 in 50, because if we could do things like that, we can take the pressure off our regular donors, but we can also help make sure that we have a stable and complete blood system in Canada. And it's a system that we continue to push at every year. As people get busier with their lives, there is more and more pressure on the people in this room. You're sitting here at 5:30 on a Monday afternoon because you have full days already. And that's very much what the average Canadian does. So as we've progressed and our lives have gotten busier and busier, we find that impacting our ability to get donors. Because it's not just filling out a form and putting $5 into a box or writing a check. We require people's time, and people's time is very valuable. But what they deliver, the gift that they give our patients, the gift that they give patients in British Columbia is priceless. We use the hashtag, It's in You to Give, for a very good reason, because that's really what we want. We want what's inside of you, whether that be your blood, the stem cells, and in this case, the advocacy that we're hoping this group can provide.
Okay, Mr. Patterson, I'm going to have to remind you that there's just 15 minutes, so we're coming close to that timeline.
All right, well, let me cut to the chase.
Thank you.
Opportunities. Our need to grow the Surrey donor base in this coming fiscal year from 1% to 4%. So while the City of Surrey has grown to almost 500,000 people, our donor base in Surrey is about 6,000 people. So that's 6,000 people that have donated at least once in the last 12 months. So we'd like to do a better job of helping Surrey residents understand that. As I mentioned earlier, the opportunity to support the ethnic diversity of our One Match program. We believe Surrey is a tremendous opportunity for us to help a more diverse range of patients and really broaden awareness of why we do what we do. Every unit of blood we collect supports Canadian patients in need. To the first part, we're looking for about 100,000 new donors in Canada, and we'll continue to push that. And we believe Surrey is a prime opportunity. Our clinic in Surrey is only open 4 days a week, 6 hours a day. I'd like to get that to a point where we need to open it 7 days a week to continue to collect blood for patients. How you can help? Really? It's encourage staff, volunteers, and community members to donate blood. This council has a great forum, both in places like this at council meetings, but also in your work throughout the community. Host an on-site clinic at the City of Surrey. That's happened already. We look forward to keeping it because it really gives us exposure as well to the citizens of Surrey. Organize regular group donations, advertise our blood clinics. There are various opportunities within the City of Surrey, whether that be web, print, etc. We'd like that opportunity to be part of that messaging to help support Surrey patients and really help us recognize the great work done by our volunteers. So those folks that work in our clinic, those folks that work on our behalf, and the volunteer donors. And I would like to thank you all for the nice step this year. Our proclamation during National Blood Donor Week, it was much appreciated, and it's very warmly received by our donors and our staff, many staff that live in Surrey. That's it. Blood.ca. We have an app. It's available on iOS or Android. Give Life. You can find a clinic, book an appointment, change an appointment, do whatever you like. What we'd like you to do is help us encourage Surrey residents to give life to Canadian patients.
Okay, thank you so much.
Thank you.
It's a very important initiative. Do council members have any questions at this point? Mayor Hepner?
Thank you. Madam Chair, and thank you for your presentation. It's indeed an invaluable service, and your numbers are really quite striking, given that we're now something like 520,000 people, and we've gone down instead of up in terms of our donations. So I think you've given us some ideas of how we could maybe help along the way, and certainly some of the links from our own website will be useful, and I'm sure staff will take that away and see how we can make some of those things happen, including community events. And thank you for your service relative to this and how important it is both in blood and in stem cell. Just out of curiosity, stem cell is taken from...
we have two types. One is the cord blood bank, so that's taken from a mom's cord blood. The other type is an adult stem cell, which is basically we put someone in a chair. For 75% of it, we put a needle in one arm, the blood goes out through a machine, we remove the stem cells, and the blood comes back in the other arm.
Okay, so it is done through blood as well?
It is done through blood, yes.
Okay, thank you.
Yes, thank you.
Good. Anything? Councillor Starchuk.
Thank you. I just wanted to sit here and not stand here, but just tell you how much I appreciate the work that you guys do out of the Surrey Clinic. I mean, the effort that it takes to go there is really minimized when you realize that the staff there are always happy, they're always smiling, they're moving you through the system in a really, really efficient way. And when you get into that lazy boy, as I like to call it, with those TVs that are in front of you, other than a little motion that you might get, you forget where you are while you're in there. And then, you know, the cookies and the coffee are the nice touch at the end, but they wait on you hand and foot, and they make that experience, the time go by so quickly. So I can't say enough about, you know, the location that you guys are in right now, and I wish I could say I had 100 donations, but I think I'm closer to 60. But, you know, hopefully before long I can get to that level. But no, you guys do a great job. Thanks.
Thank you very much.
Thank you. Not seeing any other questions. Well, thank you very much for your presentation, and we'll certainly all do what we can to assist.
Thank you very much for your